Now, it feels like there's been a new food recall every summer this week. That's not the actual tempo, but that's what it feels like. Even so, former FDA Commissioner Scott Gottlieb says the numbers this summer pretty much on par with what we have seen in recent years. Here is what he told Face the Nation yesterday about using recalls to measure whether the government's being effective in this space or not.
I wouldn't point to recalls as a measure of whether they're doing a good job or not doing a good job. Recalls really don't comport with whether or not the overall program is effective. And I don't think the program is not being effective. I think if you look at this year, there haven't been more outbreaks than what we traditionally see, with the exception of that cyclospora outbreak, which was an extraordinary outbreak, and I think points to real problems with produce that we are sourcing from portions of Mexico where you can't send in inspectors. I think FDA has done a reasonable job this year getting on top of these outbreaks when they've been identified by CDC.
So I want to bring in CBS News medical correspondent Dr. Céline Gounder on this. So we love to dig in deeper on these things and get to some of the nitty-gritty. So first question, Dr. Gounder, is it even helpful summer to summer, season to season, to count recalls in the first place?
Recalls require you having traced an infection back to the source, back to a specific food. And so we also know that there are instances where you have foodborne disease outbreaks where a food is never identified. In fact, this is the case in about 40%, almost half of all the different outbreaks that the FDA tries to investigate. So if you don't figure out what the food is, you can't recall the food. And unfortunately, it means it stays on shelves or in the grocery store, still getting people sick.
Has this summer been numerically worse than previous summers?
Cyclospora outbreak really was unprecedented in terms of size. In terms of number of outbreaks, individual outbreaks, we're probably around the same level as we typically see. But that said, the cyclospora outbreak is very concerning for a number of different reasons. Dr. Gottlieb alluded to inspections of foreign food producers. Those numbers are down by almost 30% in the past year. There's also been a cut to FDA quality checks for food labs, and CDC's parasite surveillance staff has been cut by about 70% in the past year. Much of this is related to the cuts to public health funding to both the FDA and CDC.
Here's another specific term I'm not sure my audience knows, but I think if they care about this subject, ought to know. What is the food traceability rule, and why does it matter in this conversation?
So this is a rule that was supposed to go into effect in January. And this would require food producers to track lot by lot foods that are high risk for foodborne disease outbreaks. So that would make it much easier to figure out, okay, such and such patient ate these foods. Can we trace back and see if there's a link? Without that food traceability rule, the food producers and distributors are not required to keep such detailed records. Now, it was right around the time that the FDA or the Trump administration decided to delay the implementation of that rule that Taylor Farms, the parent company of the iceberg lettuce involved in the cyclospora outbreak, that parent company gave a $1 million donation to a pro-Trump super PAC. This is in FEC records. We don't know if there is a link, but it is certainly concerning this happened right around the same time.
And Dr. Gounder, how does this all fit into the broader question of how much do we inspect, how often do we inspect, and how many inspectors do we have?
We don't have nearly enough inspectors. About 1 in 5 inspector jobs remained vacant in the past year. So we certainly need to be hiring more, having them do more frequent visits. The most recent outbreak involving alfalfa sprouts with salmonella and E. coli contamination. There was a known roof leak on top of the sprouts. The company was warned about this, and the FDA was unable to come back to reinspect before people were already hospitalized from this most recent outbreak.
That's a classic example of not being there for phase 2 of whatever you started as an inspector in phase 1. Dr. Gounder, thank you so much for your time and your expertise.